Are bipolar disorder and schizophrenia the same? Mental health is a very complicated arena. There are many disorders that share the same symptoms and sometimes even the same treatments. The reason for the similarity between symptoms and treatments is due to the origin of disorders, which is the brain. The overlapping symptoms and treatments can sometimes make getting an accurate diagnosis and a potent action plan very tricky. This is very much true for mental disorders like bipolar disorder and schizophrenia, which are actually two very distinct conditions yet are quite often confused with each other and are said to be interrelated. The truth is, they are not related. Schizophrenia versus bipolar disorder symptoms is like putting hallucinations and delusions versus extreme mood challenges. Bipolar disorder causes strong shifts in energy, mood, and activity levels. A person with bipolar disorder will switch between extreme excitement or mania and depression. These shifts can affect your ability to perform daily activities. On the other hand, schizophrenia causes symptoms that are more severe than the symptoms of bipolar disorder. People with schizophrenia experience hallucinations and delusions. Hallucinations involve seeing or hearing things that aren't there, while delusions are beliefs in things that just aren't true. People with schizophrenia may also experience disorganized thinking in which they are unable to take care of themselves. That's not all. Bipolar disorder affects approximately 2.2% population in the United States. Typically, it first appears between the late teens and early adulthood. Children can also show signs of bipolar disorder, whereas schizophrenia isn't as common as bipolar disorder. It affects only 1.1% of the US population. People usually learn they have it between the ages of 16 and 30, and it usually isn't observed in children. There are, of course, similarities like the use of Diagnostic and Statistical Manual of Mental Disorders, or DSM, for diagnosis of both the mental disorders, yet they are distinct enough to be understood and dealt with accordingly. Usually, clinicians look at the diagnostic criteria laid out and sees if the person meets it for either of these conditions. For schizophrenia, that means having at least two of the following symptoms: hallucinations, delusions, disorganized speech, agitated movement, negative symptoms such as withdrawing or cognitive impairment. One of the two necessary symptoms for schizophrenia diagnosis has to be one of the first three. The symptoms also have to be present for a significant amount of time during the span of a month. On the contrary, in bipolar, a person must have a period of mood disturbance and increased energy nearly every day for at least a week. That includes 3 or more of the following: racing thoughts, inflated self-esteem, feelings of grandiosity, a reduced need for sleep, and extra risky behavior. It is also to be noted that schizophrenia and bipolar disorder are treated with entirely different medications. Mood stabilizers are typically prescribed to people with bipolar disorder, while antipsychotic medications are mainly used in treating schizophrenia. However, there are some similarities in the approaches used in therapy to treat both bipolar disorder and schizophrenia. The goal is to improve how well people are coping with either condition. Therapy might include cognitive behavioral techniques, family support techniques, family therapy, and more to help people with these conditions get along in the world, hold on jobs, stay in school, or even just relate to their family and friends. To cut it short, bipolar disorder and schizophrenia are disorders of the brain but are two distinct medical conditions. Fighting from either is a challenging and daunting task. To win the battle, educating yourself is key. Understand the conditions and kickstart living a better life. Sign up at Aburo's online platform and get access to 15 plus health and wellness programs including bipolar disorder. What are you waiting for? Like, share, and subscribe.